What's up, guys? Today in this video, we're going to go over subacromial bursitis, what it is, causes, and 4 exercises to fix it. My name is Dr. Joey Seaforth. I'm a physical therapist, athletic trainer, and strength and conditioning specialist specializing in shoulder and overhead athletics. People that have subacromial bursitis often complain of pain as they reach across their chest or potentially as they bring their arm out to the side or above their head. Let's talk about what's actually happening. As we can see here, we have our acromion right here. And as you can see on this picture here, there's a bursa underneath it. And what happens is when we get irritation to that bursa, it's a fluid-filled sac and it becomes inflamed. So as we're moving through right here, if there's inflammation going on, all these different movements can be bothered by it. There can be a couple different causes to why we're getting that bursa that's getting a little bit inflamed. One of the main causes is weakness in the rotator cuff. There's 4 rotator cuff muscles that all attach to the shoulder blade right here. When they're not doing their job, this ball and socket tends to move a little bit more free than it should, causing a little bit more irritation between that acromion and the spot underneath it. Another possible cause could actually be stiffness in how the shoulder blade or the shoulder are moving. I'm going to give you 2 different scenarios right here. On this side, we have the shoulder blade that's connected to the ribs. Usually it's allowed to rotate, but I'm going to show you what happens if it doesn't rotate fully. As we can see here, as we lift our arm above our head, this ball and socket runs right into that space and it could be pinching on that bursa. Now let me show you what happens when our shoulder blade actually moves how it should. As I come over here, as you can see with this joint space, as we bring our shoulder above our head and bring our arm here, there's no pinching in that spot. It's offloading that bursa and we're not getting that irritation. So let's check out these 4 exercises to help work on mobility and strengthening. Exercise number 1 is a wall slide. It's going to teach our shoulder blades to move up and around and help offload the spot right here. So what you're going to do is you're going to find a wall. You're going to put just this part of your hand on the wall and let the wall do the work. So what I'm going to do is I'm going to be right here, 1 foot in front of the other. I'm going to have my hands just like this, and I'm going to slide my arms forward and up the wall and lean forward. So right here, slide up, lean forward. This should not be causing pain. If you're having pain, you need to limit the range of motion and not go as high up. Should feel nice and good here. And guys, what you're actually going to be feeling is you're going to be feeling that shoulder blade moving back there. And that's what we need to do to help put the shoulder in a better position. Next exercise is a wall open book. So we're going to be adding some rotation to help offload our shoulder and get some more mobility in our upper thoracic spine. So what you're going to do is you're going to find a wall. You're going to go into a half kneel position. The leg that's closest to the wall, the hip is going to be touching. Be right here, palms together. I'm going to open up and follow my eyes with my hand as far as I can, and then come back out of it. Just nice and easy. You might feel a stretch in that shoulder right around here. That is totally fine. Once again, you guys don't want to force this and push into pain. If you're having pain, you want to limit the motion, but continue to keep moving. Then notice how I'm bringing my eyes with it as well. So we're also bringing our neck into this exercise. Our next exercise is called a banded eye. The goal of this exercise is to bring our arms back like this and to get engagement underneath our shoulder blades. This in turn will help offload our shoulder in the front. So what you're going to do is you're going to grab a band just like this. Palms are going to be up and you're going to pull your shoulders back just like that. Hold for a few seconds, come back out of it. You want to keep your elbows nice and straight as you're doing this exercise. So I'm coming here, holding a couple seconds. You should feel a nice burn right here if you're doing it correctly. Just like that. Hold for a few seconds, back out of it. Our last exercise is called banded shoulder flexion holds. So you're going to take a seat on a bench. You're going to put 1 foot on the band just like this. We're going to make sure that our thumb is pointed straight up, and it's going to help offload that joint space right there. What I'm going to do is I'm going to hold the band in 2 different positions for 5 seconds each. So I'm going to be just like this, going at a 45-degree angle. I'm going to hold right here, 2, 3, 4, 5, and then I'm going to come up to right here, holding 2, 3, 4, 5. Instead of going all the way back down, I'm going to that original position right there, 2, 3, 4, 5, and then back up. The goal is to continue to keep holding for 5 seconds at each spot, with the goal of shooting for 45 to 60 seconds. Fair warning, guys, this is an absolute burner. Let's tie everything together, guys. We talked about how subacromial bursitis is when there's a bursa that's getting inflamed right under this spot here. We showed 4 different exercises today to help improve mobility and strength to help offload that area and to bulletproof your shoulder for future events. Thank you guys for staying and watching the video. Please like and subscribe to the channel, as it helps me get out more content to you guys and spread the message. If you guys want any future videos, please leave a comment below, and happy to do it for you. At Comeback Performance, the comeback is always stronger than the setback.